I see, there still are kind of some similarities in terms of how I would actually approach that particular issue. But definitely, as you can see, like there's tons of education. Like people need kind of some insight in terms of what's happening with their bodies.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, I'm Sarah Clark, and my mission is to inspire, motivate, and empower you. And most of all, I want you to wake up. So with functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Dr. Sinead Dufour to the podcast today, and we're digging into pelvic floor health and fertility. Dr. Sinead Dufour is an assistant clinical professor in the Faculty of Health Science at McMaster University. She teaches and conducts research in both the schools of medicine and rehabilitation science. She completed her master's in physical therapy at McMaster in 2003, her PhD in health and rehabilitation science at Western in 2011, and returned to McMaster to complete a post-doctoral fellowship in 2013. Her current research interests include conservative approaches to manage pelvic floor dysfunction, pregnancy-related pelvic girdle pain, and interprofessional collaborative practice models of service provision to enhance pelvic health. Sinead stays currently clinically through her work as the Director of Pelvic Health Services at the World of My Baby, The Womb in Milton, Ontario, Canada. And you can check out the website at The Womb at www.thewomb.ca. Before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hi, Sinead. Welcome to the podcast. Excited to have you.
Thanks, Sarah. It's so nice to be here. I'm really excited to have this chat with you today.
Yeah, awesome. So I find most people that have their own story as to how they came to this work. So maybe share with us how you became to do work with pelvic floor health.
Yeah, interestingly enough, I was actually in the process of doing my PhD when I decided, it was time for me to try to get pregnant. And so I was doing my PhD, actually it was still under the area of physio, but it was looking more at health service design. It really was not in the area of women's health or pelvic health. And of course, I started trying to get pregnant and actually ran into a lot of difficulty. And at the end of the day, I was diagnosed with unexplained infertility. And so for me to kind of get through that process and actually be able to conceive, it really did kind of require, me kind of getting some insight from more conventional medicine, but also getting insight from a really good naturopathic doctor and an osteopath and kind of a bit of a whole team approach. And then I was able to get pregnant, and I went on to get pregnant with twins. And then kind of going through the whole process of, what a woman's body deals with getting pregnant, and in my case with twins, and then recovering from that process, that was sort of another experience that I thought, wow, there is so much here with women's health kind of through this time, kind of from trying to conceive and then beyond, that really it was tough to navigate. I mean, me being a physio at that point, for probably almost 8 years, I had a hard time even navigating the system. And so that really motivated me to actually go back and do sort of additional specialized training in obstetrics and urogynecology and gastroenterology to actually do pelvic health physio. So of course I had just finished my PhD and then decided, it was important for me to do this. So at this point in time, I'm quite lucky that all my academic pursuits and my clinical pursuits are now all very much focused around pelvic health and really around this kind of perinatal care population. But yes, it was from personal experience in terms of how I landed here.
Oh, I love it. Yeah, it's sort of that organic things that typically is where you find where the sweet spot is.
Yes, absolutely.
Mm-hmm. And so pelvic health physiotherapy, why is it important for fertility, and maybe exactly what is it? Because maybe people haven't even heard of it.
Yeah, of course. So pelvic health physiotherapy, it's actually, so where I'm based out of in Ontario, in Canada, it's sort of a little bit newer up here. And one of the reasons why is because as physiotherapists, we were only regulated to actually have kind of conferred competence in this area with additional, what we call rostering in a special category once you deem to be competent since 2012. So here it's quite new. So of course, as soon as I finished my PhD in 2011, and then as soon as this changed, I kind of got the training right away. But certainly around the world, pelvic health physiotherapy is not new at all, right? But it's certainly newer here. And really, we are it's the acknowledgement that we have these tissues inside of our pelvis that we can't see and that have kind of traditionally gotten ignored, but actually they require the same amount of tension from a restoration or rehabilitation standpoint that the rest of the tissues of the body need, right? So they need to sort of be included in the mix. And so traditionally, pelvic health physiotherapy really has been used with more kind of clear-cut and obvious pelvic floor dysfunctions, such as urinary incontinence or pelvic organ prolapse, for example. And of course, we have really, really strong evidence in the literature that actually pelvic floor muscle training is provided, supervised actually by a trained physiotherapist, that this is the first line treatment. We have what's called level 1A evidence to support this. So it's basically the highest degree of evidence you can have. When we move into a topic more around fertility and trying to promote fertility, this is a space where we don't have the specific, really rigorous trials to confer that pelvic health physio improves efficacy to get outcomes for fertility. So just to put that very clear out front, we don't have that science specifically for fertility. However, if we're using the very same sort of principles of pelvic health and pelvic floor health and connecting that with sort of what do we need as a healthy foundation, understanding our physiology and biology to be able to, 1, conceive, and then 2, actually carry a baby, and then 3, actually birth the baby, hopefully with minimal issues, right? When we're applying very basic accepted rehab principles, it makes sense that there's a lot we can do in the fertility space. And certainly those of us who have started to apply these strategies in the fertility space have noticed some really, really, really positive outcomes. So I guess to be a little bit more specific, when someone kind of comes to me and they're having trouble conceiving, in some instances, they are coming with maybe a specific identified reason, kind of from conventional medicine, in terms of what might be a barrier for them to conceive, right? So maybe it's something like PCOS. But it doesn't necessarily mean that the fact that they were found to have PCOS, that's necessarily the reason why they're having trouble conceiving, right? So the point is that we really do try to look at the entire person and try to think of what are all the potential barriers that might be coming in the way of this to happen, and what can we do to kind of get rid of all those barriers, right? So in the case of something like PCOS, of course, that's like an endocrine system dysfunction. And at that very specific level, there's not a ton specifically physiotherapy can do for that. But we treat people, right? We don't treat conditions. Right. So we would still want to make sure everything else in the system is working as optimally as it could. So, what are we finding in terms of this individual's just degree of stress, and where are they at with their autonomic nervous system balance? So this is an issue that kind of comes into play a lot. We really need to make sure that women are actually able to kind of understand that they might not be at a balanced place on that continuum. And we have this continuum between what we call our parasympathetic nervous system and our sympathetic nervous system. And if we are not sort of well balanced, then we can end up with issues in our hormone called cortisol. And if cortisol is kind of too high, or actually the output of cortisol is in different amounts than where it should be throughout a 24-hour kind of what we call circadian rhythm, that level of cortisol can really start to hijack our other fertility hormones. So, and it's something that women sometimes are not really aware of, actually the state of overwhelm they're in. Sometimes women just aren't even aware of that. And if they've kind of done some conventional blood work that has shown that everything's fine, unfortunately, those testing profiles really don't show a lot of the nuances in terms of things that can be going on. So one of the first kind of conversations I often engage with women is actually talking about the basic pillars of health, right? Because we need certain foundations of health to ensure that, one, our actual physiology and hormone balance is going to be optimal, but two, that then our tissues and our musculoskeletal system are actually going to be working well, right? None of those things will happen well if we don't have a good foundation of health. So we'll talk a little bit about the autonomic nervous system and stress management and cortisol. We'll talk about sleep. Really getting good quality restorative sleep is really critical for optimal hormone balance, right? So that's something that we'll talk about. We'll talk in more of a basic way around nutrition. And certainly if it seems like more of a deep dive is required in this, just depending on the person's situation, then I'm really lucky that I work with some awesome naturopaths who can kind of really help at a more granular level with that. But certainly we want to make sure people are aware of really eating, as clean and toxin free as possible, whole foods diet, understanding aspects of diet that can actually be kind of quite inflammatory, that can actually sort of be triggering their biology in a negative way without them realizing it, right? And then of course we have exercise, right? Movement and exercise. So our tissues need to be moving for that ongoing flow through our lymphatic system. And one of the things that pops up a lot actually with this situation of unexplained infertility, that I'm kind of putting in air quotes here, is that oftentimes I will find actually that there is quite a bit of what I would kind of call almost congestion in the pelvis. So this is different than sort of a diagnostic label of pelvic congestion syndrome. I'm almost talking more kind of subclinically. We're checking the tissues. We have really kind of tight tissues across sort of the external aspect of the anterior pelvis. And then when we're inside the pelvic floor area, lots of tight tissue, but almost akin to sort of a boggy, swollen ankle. But we sort of have that in the pelvis, just kind of congested and boggy. And this can happen from just kind of too much sitting. This can happen from, a lot of inflammatory foods in the diet because of course the gut is right there. So you have an inflamed, irritated gut. You can kind of get some irritation and bogginess to other tissues. This can be just from lack of basic enough walking. There's some really good literature to show that just the act of walking and that pumping of the calf and the natural alignment that occurs between the rib cage and the pelvis that actually allows the diaphragm to move in a more optimal way, just to kind of pump that lymphatic fluid through, which occurs through walking, that can actually be hugely beneficial to pelvic health, right? So we're kind of looking at all these pillars, and then that helps us get into kind of some of the more granular pieces in terms of, okay, if we get our pillars down and now we don't have any of these obvious kind of things standing in our way, from a very specific tissue level, are there some kind of tissue restrictions that seem to be in our way? Does the pelvic floor even know how to pump? We want to make sure that the pelvic floor is helping to pump that lymphatic fluid through, but that's really important because we want to be bringing lots of nourishment into the pelvis and pulling all the kind of grotty waste products away. So we need to have the pelvic floor pumping in order to do that. We also need to make sure that the pelvic floor is in a state that the individual can even have intercourse, right? So painful intercourse is a huge prevalent issue. And the tension in the tissues that kind of tends to go along with high cortisol and someone more in that overdrive situation sort of aligns with these tight tissues that then would actually make intercourse not pleasant. Right? So we also want to make sure that, we're getting the tissues that the individual can, even on that very basic level, be engaging in intercourse potentially more often because it's more comfortable and at least enjoying it and potentially orgasming, which we know, there's some science to show that even leads to increased chances of fertility. So these are kind of some of like the frontline things that I would be thinking about.
Yeah, I love it. It's really that looking at that holistic approach, and we use the tools of functional medicine. So looking at the underlying cause of disease or illness. And then, so really for you talking about the different stressors in the body. So it could be mental, emotional. So the fight or flight, it could be structural. So maybe there is something going on structurally, I guess, in the pelvis. If there's congestion, you talked about, maybe the person isn't even moving. And then inflammation. So yeah, we do a lot with food sensitivity testing. We use a Dutch hormone test, and we look at gut testing. So for potential gut infections, and sleep is huge, like getting that 7 to 9 hours of sleep. And work with clients for like months to work on their sleep hygiene. So adding this piece in here, which potentially would be more of the structural side of things. Am I wrong on that, or what?
Yeah, so I would almost divide sort of what I do. But again, I'd say I'm a little bit more unique because I've actually have quite a bit of functional medicine training myself, whereas many pelvic physios don't, right?
Mm-hmm.
So I would say because of that, I'm probably kind of half looking at these bigger things and then kind of directing people to team members of mine to go into that in more detail, like for testing, etc. But then half of my time would be more on the structural part. Because I tend to do a lot of consultation, like I've moved a little bit more to a consultative model, probably because of my functional medicine training.
Mm-hmm.
I only see my patients once every 6 weeks. And so people who need, and that's not to say people don't require or wouldn't benefit from more hands-on care for this structural piece. Many people do, but I actually have them working with my osteopath on those. So I'll kind of identify where the tissues are having some structural problems and where that could be a potential barrier, and then have them maybe see the osteopath a couple times before they come back and see me again, for example.
Okay.
But really is a team approach. But certainly, yes, there are a lot of manual therapy pieces, and many pelvic physios would actually just do those kind of more visceral techniques themselves. Just the way that I'm kind of have set up my practice, I've come to a place where I tend to delegate that more, because I'm really kind of looking at all the pieces that, and many of which I find are missed. And I just want to make sure that sort of no stone is left unturned, and we're kind of looking at everything. And if it seems like there are kind of more rooted emotional issues that might require further attention, then I have the individual working with the social worker. If it seems like there really are some serious gut problems and quite a bit of testing needs to be done, then I'll have the individual working with our naturopathic doctor, for example. And if it seems like kind of we really need the tissues kind of worked on, then I have other manual practitioners in my clinic. So I'm sort of quarterbacking it a little bit in the way I practice.
I agree. And that team approach, because really to have one person do it all, it's sort of to refer out to specialists, and then, yeah, as you say, quarterback it. So as far as, okay, so for PCOS, obviously we're looking at the whole body, but is there anything you see with people with PCOS typically? I don't know if everyone's different, so I don't know if there's anything.
Yeah, I mean, I guess my biggest thing I would say about something like a PCOS is because, I mean, we know that there are many people who have been told, oh, you have PCOS, but then they end up getting pregnant, right? So, I think it's certainly helpful to identify potential barriers. Absolutely. But I'm of the mindset that I never want to make an assumption that something that was found is necessarily the reason. It sort of speaks to the same data that we have for MRIs and lower back pain, and how we have so much evidence now showing that there is dysfunctions in people who have no pain. Mm-hmm. So it's really spoken to the point of, actually, for people who have back pain, we really shouldn't be sending them for these MRI scans, because it's going to probably find something, and that actually has nothing to do with why the person has pain, right? So, I mean, we know that it's such a complex symphony in terms of everything that happens for someone to conceive and carry a baby. So when someone comes in with PCOS, I think, okay, that's helpful. And that's helpful that you know that that's going on. And, hopefully you have a plan that you're going to try to manage that. But certainly, I mean, if they had not already been sort of empowered to look at diet and other ways of kind of getting that system back on track, I'd have them working with our naturopath on that. But I'd also be looking at the system almost with a fresh pair of eyes to see if there's any other kind of what I would call barriers that are obvious that are in the way. Someone might come in with PCOS, but actually no one's even had a conversation with them about diet or sleep. Mm-hmm. And, you could ask a couple other poignant questions, and, it shows that there is huge room for improvement on those two places, right? So, that would be one thing with something like that. Something like, let's say, with like an interstitial cystitis, for example, mm-hmm. where this is a condition that's a lot more aligned with something we call central sensitization. And so, certainly in a situation where essentially it's the nervous system, but the nervous system we can't really separate from the immune system, right? So it's really your systems are kind of in this ramped up, hypervigilant sort of state. And so, of course, one of the ways that this is manifesting in this particular situation is that the bladder and the tissues around the bladder are hypersensitive and hyper irritable, right? Well, definitely we would be wanting to address some of the additional tissue tension. And we could certainly do that through some manual techniques, but we'd also want a little bit more kind of like a top-down approach where we're trying to actually reduce some of the hypersensitivity in the system, right? So we'll want to do this through some sort of movement techniques like Qigong or maybe some yoga techniques. We'll want to make sure that, the client we're working with really understands the strong scientific basis behind different meditation and mindfulness strategies, because this actually becomes a really important part of this problem. And we also want to teach this person about how pain actually works, pain science, neuroeducation, right? And so they kind of understand that, their body is responding in a way that's hypersensitive, but it doesn't necessarily mean there's something damaging and threatening in their body. So they can actually start to learn to kind of rewire some of that, right? And certainly many of the same things that are going to not allow us to sort of positively neuroplastically change a system that is in central sensitization come back to some of those basic elements about, making sure that we're reducing toxins, we have a non-inflammatory diet, we're getting good sleep. These are some of the foundational things we need to actually have really good success to kind of rewire that nervous system, right? So even in a situation like IC, there still are kind of some similarities in terms of how I would actually approach that particular issue. But definitely, as you can see, there's tons of education. People need kind of some insight in terms of what's happening with their body so they can kind of understand, okay, why is it that this might also be contributing with my difficulties trying to conceive? Because in many cases, it's never been explained to them. And once they can kind of connect the dots and sort of see, really many of these basic health promoting behaviors, in addition to some very specific manual techniques, are all going to kind of address sort of some of the common roots of many of the issues they're having. I think it's actually quite hopeful for people, right? And then they're more motivated to move on.
Absolutely. I agree. And a lot of people get, stuck on their diagnosis, and when you use the tools of functional medicine and then dig deeper, it's typically, it's not just that. There's other things going on. Like you talked about the toxins and using yoga and mindfulness and all sorts of things like that. It's, looking at it all, but in a targeted approach.
Absolutely.
And so for fertility, so someone that's gone and, done some food sensitivity testing, the elimination diet, they look at their hormones, we found there's potentially a gut infection. They're, working on all these things, removing environmental toxins, and they're working on their mental emotional stressors. At what point do we bring in the pelvic floor specialist? I don't know.
Yeah. So, I always kind of seem to think sort of the sooner the better, although I guess my other caveat with that would be it kind of depends, I guess you would say, in terms of how that provider practices. So if you are kind of connected within your community, a pelvic health physiotherapist who really is a little bit more sort of manually focused and focused in that one particular arena, then it might make more sense for you to have some of these foundational things sort of cleaned up a bit. So that person isn't going for these treatments on their musculoskeletal tissues only to have their foundation not very good. So then they kind of keep sort of dumping junk back into their tissues and their tissues get tight again, right? It's kind of a waste of their time, right? Whereas, if you were working with someone who maybe had some functional medicine training or looked at things a little bit more holistically, it might be helpful to actually get this person engaged once early on in the process. But then again, maybe checking in with this person every kind of 6 weeks. And why that can be helpful is, so let's say I see someone and we kind of go through all the things and, I'm able to show them through some of the techniques I do. So I do one technique that's just called connective tissue work. And it's essentially almost like a skin rolling technique across the front of the pelvis. Mm-hmm. And so in many of the women with the different presentations that we've just discussed, they actually will have quite obvious restrictions in this tissue that they've never even been aware of, and as I'm doing this technique and it's not overly comfortable, they are really aware of, wow, oh my gosh, like my tissue is all stuck together and like this tissue is almost stuck onto my bladder, and they can almost think, oh my gosh, like nothing's moving, everything's like strangled in there, right? But it can be helpful if then it's like, okay, great, so now you're going to work on your sleep or your emotional issues or the infection in your gut or all the other things, and you're going to go off to an awesome practitioner who's going to help you with those things, and then come back and we'll say, okay, well, where are your tissues at now? And then maybe 6 weeks later, where are your tissues at now? So that can kind of be helpful, that they can start to see that all their other hard work and those changes that they're making are really making a difference in their tissues, right? They're starting to get it that, yeah, we're starting to change the soil, and now we're actually seeing a change in what the leaf looks like on the plant, right? Like they're kind of starting to see that. But again, if it was someone who practices more in a way, if they want to see their patients like once a week or twice a week specifically just for manual techniques, I think it would be in the better interest of the patient, because it can get very overwhelming for these folks with how many appointments they can end up having, on this journey. And I would say it would probably be most beneficial to have the bulk of that kind of muscular work done sort of once the soil is sorted out, if that makes sense.
Totally. Yeah. Okay.
Yeah.
So maybe can you walk us through a pelvic floor examination and kind of what you look for?
Yeah, of course. So I do, as I say, I kind of first just look kind of globally at the external tissues. I can get a pretty good sense of sort of the state of where that autonomic nervous system is based on sort of patterns of tension sort of in the upper traps around the neck, through the thoracic spine, and then over top of the pelvis, and just tension through the hips when I'm checking rotation of the hips. So oftentimes just through a very quick external sort of scan, I can kind of get an idea of what the tissues are going to be like. And then I will kind of check for kind of trigger points externally, like around sort of the bladder and at different spots through the abdominal wall. And then I'll move on to my internal exam. And this is an exam that I will sometimes just sort of use like one finger to do this exam. Sometimes I'll use two. It will just kind of depend how sort of tight or sensitive the tissues are. But essentially, I am first checking just the general sort of health and tone of the pelvic floor. So basically kind of with one finger inserted, the woman is kind of lying on her back with her knees bent. I'm usually actually sitting beside the woman. So many women actually find that's a lot more comfortable than me kind of sitting at the end. Certainly women don't have their legs up in stirrups or anything like that. They're totally covered and I'm sort of sitting beside them. It's a much more sort of collaborative and I think safe feeling type of an exam. But I'll check the sort of the health of the tissue. So I'll be noticing sort of places that feel like high tone under my finger. So really the pelvic floor should almost feel like a steak that's medium rare. Like that's what the muscle tone should approximately feel like. And I'm looking
that's
for
a really good visual.
Yeah. So that's kind of what you would sort of want it to feel like approximately if it's nice and healthy. But I'm almost looking for places where it feels like it's well done. And in those places that feel like it's well done, am I also noticing that the individual is kind of flinching or telling me, oh, that's hurt, that's painful there, right? So we're looking kind of for these upregulated, sensitized spots in the pelvic floor. I'm also kind of getting a sense of, as I said almost before, like that bogginess. Does it feel like there's actually pockets of this interstitial or lymphatic fluid that's kind of like this boggy sort of congested pelvis? So I'm feeling for those things. I'm feeling to make sure the pelvic organs are okay. So really like along the back of the pelvic floor, it should be nice and flat. There shouldn't be like this massive bump that would mean the rectum was kind of pouching into the vaginal space. I also shouldn't be able to feel the bladder hanging right down into my hand, right? And I also shouldn't feel the cervix like right there as soon as I start my exam, right? I should really need to almost go sort of trying to reach for the cervix. So, if it's obvious that, any of those kind of tissues are off, I'm looking for that. And then of course I want to determine the contractile properties of the pelvic floor. So, I'll ask the individual if they kind of know how to contract their pelvic floor. In many cases, women don't. They think they do, but what they do isn't it. And we need to actually kind of go through almost a little bit of sensory mapping and cueing to connect their brain back to it. And, really wanting to make sure that, they understand how to contract their pelvic floor and then relax their pelvic floor. Because what we find more often with the women we see with fertility problems is actually that more often those tissues tend to be held quite tight, and the woman actually doesn't know how to release those tissues. Right? So, and this is certainly the presentation that would go along with sensitized tissues or high cortisol or any of these states, right? So we really want to make sure that we make them aware of that they're like, oh my gosh, I didn't even realize that I've been like permanently like clenching these. And that awareness can be really, really helpful. And they learn how to drop the tissues, and then we'll want them to learn how to contract and relax their tissues consciously in sync with the diaphragm. So of course, when we inhale is when the diaphragm drops and the pelvic floor will naturally lengthen. And when we exhale is where the diaphragm will lift and the pelvic floor will naturally contract a bit. So we'll sort of teach people how to kind of almost really accentuate those aspects. So they're kind of working in sort of a synchronized way with their diaphragm. So those are kind of the main things I would be looking at and sort of interjecting kind of treatment as I go through an exam like that.
So typically some of the treatment then you'd see was, so of people with fertility issues, more contracted, what would you recommend in that stage to how to do that? Is it typically breathing, or is it?
Yeah. So, the sooner I'm able to kind of institute this, it's what we call the core breath, where someone can kind of inhale and sort of expand and visualize the pelvic floor really, really dropping and relaxing fully, and then exhale, consciously contract. The sooner I can implement that, the better, because that's kind of a way we're going to get sort of good pumping through the tissues, good sort of contractile kind of properties through the tissues to keep them healthy. But if the individual is so upregulated that any attempts to contract the tissues, they just cannot let go again, then they are not even ready for that. And then it would be exactly as you said, it would be breathing. It would be while they are diaphragmatic breathing, just visualizing as they inhale, the pelvic floor fully opening. And the cue I often give is a flower, like a flower inhale, it's blooming open, it's blooming fully open. And then as you exhale, you kind of notice the flower is very naturally just kind of closing up again. And you're just kind of trying to connect that visual with the awareness in your body so that we can get people sort of out of kind of staying contracted and really learning how to relax and open. So the emphasis is more on really the flower blooming with diaphragmatic breathing. And
so
then
really kind of, sorry, is it really that belly breathing then? So when you breathe in, the belly goes out. Is that what we're doing?
Right. But we don't really want to emphasize kind of forcing out the belly, because a lot of the times when people are sensitized, there's a lot of kind of forced embraced behaviors that have adapted. So we really want to get people back into trusting their motor cortex and trusting the visualization. So I will actually say, like, yeah, you're going to be here. You're going to be breathing. You're going to first kind of notice that the breath is probably going to be in your chest, because these individuals are typically more upregulated and are kind of programmed to do a lot of this apical breathing. And then I will say, like, you're now just going to invite the breath to come in a little slower and a little lower, right? You're not going to force it to do something. You're just going to kind of suggest it and invite it. And once they in fact witness that, they're like, okay, yeah, I feel the movement now, less in my chest. It's more in kind of my lower ribs, and it's a little bit more in my belly. Then I say, okay, so that's great. So now we're out of your chest. We're getting the diaphragm doing something. Now we're going to switch to this visualization where we're going to try to connect what we're doing with the diaphragm. So when we inhale, that's connected with really visualizing a flower almost blooming right out of your vagina. That's where you're visualizing it. You're visualizing it at the pelvic floor. There's a flower there. We inhale, it blooms, it fully opens. We exhale, we just notice it's going to retreat a little bit, right? So there's no conscious contraction with that. And then we'd be wanting to very quickly move to the point where we could actually get some conscious contraction. So sometimes within the assessment with someone, I'm actually able to move them right through to doing this core breath. But for other people, I'm not. And I say, okay, so let's just leave it as this. So you're going to be working on this breathing. You're going to be going for walks in nature once a day. You're going to, like, I'll have a whole list of things, right? Maybe there's certain things that in their action plan around sleep, whatever, right? We'll kind of have a plan, and then they'll come back in 6 weeks. And my hope will be that now their system has shifted enough that now we can actually get the pelvic floor going with the core breath, because we do want to move people to the point that their pelvic floor is able to contract nice and healthy by the time the person conceives, because we have great evidence that pelvic floor muscle training in pregnancy prevents urinary incontinence, prevents lumbopelvic pain, and actually shortens the second stage and reduces in less tearing. right?
Mm-hmm.
So, we're kind of preparing for this all along the way. But if we institute contractions when the tissues can't even release, then that's totally sort of a mistimed part of the intervention. It'll actually make things worse, as you can appreciate.
And so the core breath, sorry, can you go into that for us a little more?
Yeah, so the core breath, it's essentially a strategy where we are buddying up the functions of the diaphragm with the pelvic floor. And actually a colleague of mine who works out in British Columbia in Canada, her name's Kim Vopney, she has an awesome YouTube video that highlights this. So you could even just YouTube Kim Vopney, the core breath, and it will come up. It's something I actually send my patients all the time because she's done quite a beautiful job with it. But essentially, so if I'm sitting up right now and I'm actually just at the edge of my seat and I'm kind of sitting up tall, just making sure I'm sitting on my sit bones and I'm not slumped sitting on my tailbone, right? And that way sort of my rib cage is stacked kind of on top of my pelvis, right? So this is going to set you up for a nice relationship between the pelvic floor and the diaphragm. So as I'm here, I'm going to kind of notice my perineum is almost like the part of my body that's kind of right in the center of those sit bones that I'm sitting on. And if I'm going to think of, okay, when I'm exhaling and I'm contracting, what I'm going to visualize is I'm going to visualize pulling my perineum up to the crown of the head, because that's the motion we want to be going for a correct pelvic floor contraction. It's a lifting motion. It's not a squeezing motion. It's a lifting motion. So if I was doing the core breath here, I'd be wanting to think about, as I'm inhale and the diaphragm is dropping and my pelvic floor is expanding, I'm almost imagining my sit bones widening a little bit. And then I exhale, that's when I'm going to try to consciously pull up that perineum up towards the crown of my head as I'm exhaling. And then I will actually kind of almost notice, it almost feels like my sit bones are kind of coming together. And I'll also feel some associated contraction through my transversus abdominis, which is your abdominal corset deep muscle. And so when you're kind of coordinating this is a really nice way to kind of build back and restore that function between your pelvic floor and the other core muscles. So that's often, something I'm trying to get to that. And then I'd want the person to maybe kind of stop throughout their day and do maybe sort of 10 of those sort of at a time, kind of throughout their day, ideally in different positions, right? That's kind of level 1 of pelvic floor muscle retraining. And then from there, of course, you'd move on to more specific training protocols depending on what the problem is. So the problem's incontinence, it would be one thing. If the problem's pelvic organ prolapse, it would be like a much more involved, more intense kind of program. So it sort of depends. But certainly with fertility, I always want to get to the point of this core breath. And sometimes that's like once I get to that point, I'm actually happy. I actually don't want to necessarily move on to a pelvic floor muscle training protocol until they're pregnant, because I'm happy at this point. The pelvic floor is working. There's no other structural barriers that we could see. Some of their other foundational physiology and biology is being sorted out, and then we're good to go. And then they're pregnant. Then we can be like, okay, so now you're pregnant, you're doing well. Now we're going to institute some pelvic floor muscle training with the purpose of keeping you with an awesome pregnancy, preventing urinary incontinence, and improving your birth outcomes, right, in terms of pelvic floor trauma. So that would kind of more be the goal. It's rare for someone with fertility issues that I'd be kind of needing to do more than just getting the pelvic floor going with the core breath. And the only reasons I would, if someone was coming to me with problems with fertility, but they were also presenting with incontinence, or they were also presenting with something else, that it seemed prudent to kind of move beyond kind of that core breath to really get some more training effects going in those tissues.
So typically you're seeing people that are dealing with fertility challenges that it's in a more contraction rather than relaxed state, the pelvic floor.
Absolutely. Absolutely. Like I'd say it would be like 98%.
Oh, wow. Okay.
Kind of thing, like almost all. But I mean, even in my whole practice, even people who have incontinence, I'd probably say it's like 80% as they're more contracted.
Mm-hmm. And so that YouTube video is Kim Vopney. How do you spell her last
name? Vopni, Vopni.
Oh, Vopni. Okay. Vopni. Awesome. Yeah. I can check that out on YouTube.
Yeah.
Okay. And then as far as any manual therapies you would use for fertility?
Yeah. So one of them that I always use is something that I call mapping. So this is kind of after I've sort of just assessed sort of, the lay of the land of exactly kind of what's happening in the pelvic floor. And oftentimes I'm sort of intermixing now sort of a treatment approach kind of with an assessment. Then I might go back and assess something else. And, the way many practitioners kind of do, it's like the art of what we do, right? But mapping is usually one of the first things I do. And this is essentially, as I'm kind of going through the tissue, it's almost more of, I guess, a cognitive exercise, but it's definitely a mind-body type of an experience where you're actually highlighting to the individual, feel right here. And they'll say, yeah, oh gosh, that's sore. And I'll kind of tell them, yeah, so this is sort of where it feels more like a well-done steak. So I'm not surprised that it's actually more sensitive. Technically it should be, and it's uncomfortable for you, right? So I'll reassure them. I'll say, there's actually nothing wrong with this tissue other than it's being held tight. So, I'll oftentimes give them the mantra that I want them to say, the mantra, I'm sore, but I'm safe. So they can kind of recognize it isn't actually a real threat. It's that they're almost in this sensitized state, and it's a hyper surveillance that's kind of happening. And I'll say, so I want you to just reassure yourself that they're safe. The tissues are actually okay. They're just tight. And, some of the discomfort is this hypersensitivity. Some of it's probably even ischemic discomfort because it's held so tight, right? So then I'll say, I want you to, with your brain, really focus on exactly where my hand is and give that part of your body permission to surrender. Like, give it permission to let go. It doesn't need to protect you like this. It's actually counterproductive at this point, right? It's become a maladaptive strategy, right? And then they'll say, okay, so I say, so I'm not going to change what my hand's doing. I'm not going to change the pressure. I'm just going to stay here. And I want you to tell that part of your body to let go. And they do, and then it'll let go. And then I'll say, okay, and I'll feel it right away under my hand that it's now not like a well-done steak anymore, right? And I'll say back to them, okay, what do you feel? They're like, oh, well, it doesn't hurt anymore. I'll say, because you let it go. And then I'll show it, and I'll basically map the entire pelvic floor like that. So then they kind of start to get an awareness of, wow, like a lot of that was sort of this unintentional holding, right? It's the autonomic nervous system, your automatic system. Your autonomic nervous system governs the pelvic floor. Pelvic floor is not wired by our somatic system the way our biceps are, right? So many people can kind of have these sort of responses to stress or other things in life that they might not even be aware of. And this is what they're doing automatically, right? So once people can be aware of, oh my God, yeah, wow, that just feels so much different in my body. And I'll say, like, can you appreciate now, like now that you're aware, I helped you be aware of that, but you don't need me doing that for you every day. You just need more body awareness between your mind and your pelvis and reassuring of safety and surrendering and letting go. And can you appreciate how that's going to allow for better sort of oxygenation of those tissues? And I'll say, yeah, so that's a big part of manual work that I do. Another part, of course, is actually some manual facilitation to get the brain to kind of learn how to contract the pelvic floor. And sometimes that kind of requires some tapping or other sort of techniques. That's what we would call sort of more peripheral neuromodulation, where we're trying to get the pelvic floor to actually respond to what the brain's trying to tell it to do. I mentioned already that sometimes I will do some skin rolling techniques kind of more externally. Sometimes I will do techniques actually in around the tailbone. So, as I'm asking about sort of other symptoms that might give me clues about what might be happening in the pelvic floor and how the pelvic floor might be contributing to a fertility problem, if anyone's kind of indicated they have a history of falling on their tailbone, or maybe they had birth like 10 years ago and they're in what we call like almost secondary infertility, right? And they kind of indicated, yeah, they were actually supine when they delivered and their tailbone was sore for a few years after that, right? We know the tailbone can break or get side bent if people birth their babies on their back. So oftentimes another manual technique I will do is actually I will go rectally to check the pelvic floor, but that position allows me to make sure that the tailbone is actually moving properly. It's not side bent, because of course if the tailbone's not moving well, it's a bit side bent, all the tissues around are going to kind of guard, and we can get all these sort of dysfunctions in and around that area compensating to this, right? So when we can kind of at least make sure like the tailbone is moving well and that's out of the way, that can be another thing that can help. That can also be another reason why it can make people have a difficult time evacuating, right? If the tailbone's kind of side bent and kind of tucked under funny, and then if people aren't evacuating well, and then they're holding this toxic fecal matter in their gut for longer than they should, and it isn't really a diet issue, it's more of a structural evacuation problem, we can even get like the gut cleared out and a lot happier, and then the other tissue's happier if we're addressing that issue. So that's another manual technique that I will do. And I have some osteopaths actually in town who specifically send people to me just to fix the tailbone, and then I'll just send them right back. So the person will kind of come to me for one visit. I'll check everything, see if there's any kind of more broader health things that I think maybe the osteo wasn't attending to that might be helpful. I'll sort out the tailbone, and then I'll send them right back.
Yeah, and with that, I guess with the mapping, just back to that for a little minute. So
Yeah,
you're
of
saying
course.
that the mantra about saying sore and safe, which was neat. But even to be able to, is it the fact when someone feels you in there and they then can connect the place they were contracting or holding on to?
Exactly. I think that they can connect, that they're like, oh yeah, that's sore. And then I say, okay, so I'm not going to release it for you. You do it. Like, you tell your brain, tell it to release, and they do. And they're like, oh, so one, I think it is a self-efficacy treatment to show them that if they are actually willing to mindfully put the effort into the mind body, that they have a lot of power over it. But two, it is that sort of tactile kinesthetic feedback that many people need to understand exactly where. I mean, the pelvic floor is tricky because we can't see it, we can't feel it, we can't touch it. We're very disconnected from it. And it's governed by our autonomic nervous system. And so many people have issues that can kind of track back to this being like one of the problems, right? So I think once people actually have that almost like an aha moment, it's almost like a Control-Alt-Delete, where it's like almost like a reset, where you're like, oh wow, like I had no idea, but now I get it. Now I get exactly where in my mind I need to let go. And now I'm kind of aware of, oh yeah, that sensation that I've kind of just gotten used to and have been ignoring. Yeah, that's a sensation of me holding tension in my pelvic floor. Okay, I got to consciously let that go, right? And it can be helpful when then that's kind of done, maybe again, let's say like 4 or 6 weeks later, just to kind of reinforce what's happening. So I'd say it's probably working on a few different levels. It is that legitimate tactile biofeedback, which I think is really important for people. But I also think it is, a powerful therapeutic piece to self-efficacy, because it helps people realize that they don't necessarily need a practitioner to release all their tight tissues, that, a little bit of help, of course, will be good and in some cases important and necessary. But there's a lot that they can do to modulate this. They just need to know how. And so that initial coaching and feedback is really important.
Yeah, and then layering in between sessions or afterwards. So things like we offer fertility yoga, and we have mind body fertility. So it's sort of those kind of different things.
Exactly.
Yeah,
like those things are golden. Like acupuncture can be really helpful too. There's incredible science to support that, right? So I mean, those strategies are really good. Yoga. I mean, even there's lots of really good, amazing science for foresting and walks in nature, by yourself, not necessarily with your dog or a dependent or something that's going to like upregulate you, but, a time for you to truly just be and connect in nature and be. That can be so powerful to help you rebalance your autonomic nervous system. But it almost seems so basic that, I think many individuals are kind of not necessarily believing the power that can have, but that can have a lot of power, particularly. So if you're out going for a walk, and let's say it becomes a little bit of a new normal, and now you're doing that and you don't have all these horrifying, like tight blocks through your pelvic floor, well, now every time you walk, that's going to be such a nourishing exercise for you, right? You're going to actually benefit from it a lot more than maybe you did before, when your pelvic floor was held tight and you weren't aware of it. And your whole walk, you're walking in this apical breathing pattern without even being aware of it, and you had all this tight fascia across your abdominal wall, and maybe one of your ovaries was actually a bit twisted because of the tension, right? So, I mean, we get all that kind of sorted out. And then we get people on these like nice walking protocols. I mean, it can be really, really powerful, but quite simple, right?
Yeah, definitely. I have people do mindful walking, which is something that I aim to do as well. It's sort of, sometimes you can be on that 20-minute walk, and next thing you know, we're all up in your head. So it's, to be present where you are.
Exactly. Exactly.
And so what's your take on Kegels?
Yeah. So, I mean, Kegels, so pelvic floor muscle contractions is essentially what many people sort of think of being the same as Kegels, right? And generally, pelvic floor muscle contractions, if they're done in a protocol that aligns with what Dr. Arnold Kegel did in the 50s, and really, he kind of came up with this protocol actually for women to be able to keep diaphragms in. So, I mean, these are protocols that are really meant to bulk up tissue that needs developed fitness to kind of hold, to either really correct a lot of atrophy that's causing stress urinary incontinence, or maybe to really close up and support the organs better. So those types of protocols generally isn't what we're looking for when someone's coming to us with fertility issues.
Right.
Do I think it's prudent to get the pelvic floor contracting and relaxing? Absolutely. And I talked about that in the context of the core breath. If there were other issues going on, would it maybe be clinically important to kind of start to move towards a pelvic floor muscle training protocol that sort of was congruent with kind of what a Kegel protocol looks like? Possibly. But generally, we really are wanting to make sure that the pelvic floor tissues are not being held up too high and tight, and actually that they can move in concert with the diaphragm. So, you know, if I was going to kind of say like general advice, like sort of generally, would a Kegel protocol and someone who's having difficulty conceiving, is that generally what I would go to? No.
Yeah. So you would look at the breathing with the flower technique, and then the core breath with Kim Botany.
Yeah, with Kim Botany. Those are things that I would definitely be looking at first. And then it would be, yes, once the individual conceived and everything's good, then absolutely adopting something along the lines of more of a traditional Kegel protocol, because those are the protocols that have been shown to prevent urinary incontinence when they're instituted during pregnancy. Those are the types of protocols that have been shown to shorten the second stage and reduce pelvic floor tearing, right? So there certainly is a value for that at different times in a woman's life. It would sort of be in, I'd say, kind of more unique cases that type of an approach would necessarily be helpful for women who are having difficulty conceiving.
Okay, great. And as far as you've mentioned a few resources, any books or websites or anything you'd like to recommend for?
Well, actually, two YouTube videos that I really like, and you're probably familiar with these, Sarah, but it's Jessica Drummond's Hormones 101. Mm-hmm. So Jessica Drummond, of course, she has lots of functional medicine training, but she's also a physical therapist. So I've done some kind of training with her, but this is a really nice overview just to understand the milieu of the hormones. She explains things really, really easily and really kind of interjects and relates things to fertility, women's health, physiotherapy. So I think that's a good one. Another good one, and a functional medicine practitioner who I've taken training with, is Aviva Roms, the stress response for women's health. So it's a YouTube video. It's about an hour, but she does a really good job explaining these pieces.
Excellent. So Aviva Rom, a stress response for women's health, and then Jessica Drummond, Hormones 101. I'll put some links in the show notes for that. That's awesome. Thank you.
Perfect.
Yeah. And is there a success story around fertility? If you can share one with us?
Yeah. So, I mean, I must say,
we have lots.
I was going to say, like, I'm so lucky to actually have many, which is great. It's one of the things that I love about what I do. But probably one that stands out actually is when the womb, which is of course where I work, first opened, and this was in 2014. One of my first clients who came to me was a 47-year-old woman, and she had kind of been up and down and in through the ringer in terms of trying different fertility approaches, and almost kind of came to me as like a last resort, but had kind of heard of me from someone and just thought maybe this can work. And following the exact kind of same approach as what we've discussed today, there was a kind of so she had been in and out of multiple different fertility clinics, and she had a number of different sort of diagnoses or labels placed on her, which I'm not like, those are important and those are relevant, but as you even said, like my approach is similar to yours, where I really don't want people getting stuck on those. Like those are important and we need to keep those in mind, and those give us some information, but we have to kind of see what else we're dealing with, right? So really kind of with that approach and following the things that we followed, within 4 months, she was pregnant.
Wow.
And it was pretty amazing. And I mean, she has like now even gone on that I feel like she's such sort of an ambassador for women's health. She's like desperate to open up a womb in where she lives, which is up in Vaughan, Ontario. And yeah, that was a really powerful story in terms of what is possible when we really do apply approach of, okay, we're as individuals coming in with what seems like a pretty kind of complex situation. A lot of these different diagnoses have tried a number of fairly invasive things, but what corners have we not looked in, right? And sometimes it's the littlest nudges that have the biggest results. You know, it's interesting. Even if I think of like how complex and complicated the manual therapy approaches I actually used to do in my practice. And in ways I actually had to weed them out because I don't have the ability to see people often enough for it to make sense that I keep doing that, because I have quite a wait list now. Mm-hmm. But I must say it's interesting that I almost feel like my more simpler approaches actually work better. You know, so yeah, sometimes the most simplest shifts actually have the biggest ripple effects. It's really incredible, you know, but that's a very tangible example that I just think does highlight what is possible.
Mm-hmm. Beautiful. So as far as where people can find you, they can find you at The Womb. So thewomb.ca.
That's right.
There's a Womb Facebook that they can go to, The Womb. And also you have remote consults. Maybe share a little bit about how people can get in contact with you.
Yeah, for sure. So if anyone is interested in doing a remote consult with me, that's fine. I do remote consults from time to time. And of course, with my pediatric population, who I really generally am not doing a lot of physical assessment with them. It's a lot of education with the parents generally. Probably best to email me directly from those at Dr. So dr.Sinead, Sinead, at thewomb.ca, because I don't necessarily need to be limited to my space that I have at my clinic for those, and then I'm able to kind of be a little bit more flexible with my timing. So it's probably easiest for people to connect with me directly for any type of a consultation.
Awesome. Great. So that's Dr.Sinead, I guess it's Sinead, or?
It's pronounced Sinead, but it's spelt Sinead. It's an Irish name. It's a Gaelic name.
Sinead O'Connor.
Exactly. Yeah. My maiden last name was O'Sullivan. So it's Dr.Sinead, so Sinead at thewomb.ca.
Perfect. Awesome. Well, this was such a great talk, and I learned so much, and I really appreciate you coming on and sharing your words of wisdom with us.
Okay, great. Thank you so much, Sarah, for having me on. It was such a pleasure.
Great. Thank you. Hey there, Sarah Clark here. So are you struggling to have your baby? First of all, please know that my heart goes out to you. I support couples worldwide who are struggling with infertility to conceive and have healthy babies. Women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system. Or Danielle, who after 2 failed IUIs was able to get pregnant after a Supercharger fertility discovery call with me. So here's how you get my help for free. So I offer a free Supercharger fertility discovery call, and on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone, and I'm really picky about who I get to speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. So first of all, you need to be able to explore your infertility diagnosis in a new light. So this offers for people who are open-minded, they're coachable, and if you can do that and want to double or triple your chances at the fertility clinic or get pregnant, awesome. So let's get on the phone and chat. Also, you must be an action taker. So someone who's committed to seeing results, you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. But if you're one of those people who like to consume a ton of information, but don't like to spend time implementing and seeing results, then the call's not really for you. So I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. So it's a really short application that just tells me about your health, how long you've been trying to conceive, and how soon you'd like to be pregnant. So seriously, this is going to be the best time you've ever spent on your fertility. Looking forward to chatting. Talk soon. Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTILE to 345-345. You'll be prompted to enter your email address and you'll receive our fertility yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, FERTILE, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, Medical Director of the Cleveland Clinic Center for Functional Medicine and Chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.